What day of the week is it, you guys? I think it might be Wednesday, and you know what that means. It's Wellness Wednesday! Happy Wellness Wednesday, you guys! I'm very excited because it's Wellness Wednesday, but I'm also very excited because we're going to talk about something that probably affects a lot of you, and that is 3 commonly weak muscles in almost everybody I see. My top 3 that I think everybody should work on strengthening, what the muscles do, what's a sign of their weakness, and how we strengthen them. Number 1, definitely for me, is the glute med. Gluteus medius is of course involved in hip abduction, moving the leg out like this, but it's also involved in pelvic stabilization when you're walking or running or even just standing there. People that have a weak glute med, which is a little muscle sits on the outside here, kind of the butt, they go like that. They kick it out because it's not strong enough to keep them up like this, right? So when it's weak, you often see that, of course. Now if that happens, what happens to the knee? Well, the bone, your femur is like this, right? So that means the knee often goes in and the hip kicks out. So they have valgus knees, right? It's like they're stuck in like this, right? So they're weak and you can't keep them out like that. When they walk, maybe the knees will come in, the legs will come in, and the hips will kick out, often accompanied with knee pain or low back pain. So what do we do for a weak glute med is a good question. Of course, hip abduction stuff, right? So anything that brings the hip out. You can stand against a wall, you can bring the foot out like this. You can get into a monster walk where you crouch down like this, put a band around your legs here, like an inch above the knee, or if you want to make it a little harder around the ankles, you come up forward at an angle, forward at an angle, forward at an angle. You're sticking the butt out nice like this, and you can also do the same thing going back, right? Back at an angle, back at an angle. You can do that just moving side to side, right? Lateral band walks. So you're like this, you have the band around your legs here, and you're going side to side. And notice I'm keeping this foot pointed forward. The foot's going to want to, kind of rotate out like this. That'll be a little more hip flexor. We don't really want that. So make sure when you're doing that to focus on the glute med. You're sticking that booty out, keeping that foot pointed forward. I like to say lead with the heel when you're going, right? To help keep that foot that way. Of course, we have our mat out for a reason. We're going to show you 2 other ones. You got Clam shells. And you got abduction, right, of the leg. So let's just show you simple abduction. How you doing? So abduction, I would like your leg behind you like this, and the toe pointed down, and bringing it up, right? So the leg is back, and I like to really reach forward like this to tilt my pelvis so that I have to use that glute med. And I feel a nice squeeze here, right where I want to feel it. Okay, you shouldn't come back. You're going to feel it more here. You want to make sure you're forward, make sure the leg's not in front or just right here. Make sure it's a little behind you and you keep that toe pointed down. Next one is a clam shell. So you're kind of like this and you have a band around your legs. If you can't do the band, you keep your feet together and you're just rolling that leg up. Again, this arm goes forward, so you have to use those muscles, right? So I like to really feel it like that, when I'm leaning forward, force myself to get over here and really use the right muscles. So that one, you can watch videos on that to make sure you're doing it right. Number 1, glute med, for sure. Number 2, lower trapezius. So we know the traps for gut big traps, right? So yeah, every guy works out with all these big traps, right? Doing all these shrugs, all that kind of crap like that. That's good. It's all well and good. Upper traps are good. But guys, there's 2 other parts of the traps. We have the mid and lower trapezii as well. They're oft overlooked when it comes to working out the traps. And when it comes to everyday posture, they're often really weak. And when we get those weak, what does it kind of look like? Let's talk about what they do first. Well, they depress the shoulder blades, do the lower trapezii. So they bring them down and they tilt them upward. So they kind of bring them down and then tilt you like this, right? So that's really nice posture if somebody's walking like that. We love that. But nobody's got good posture. Everybody's like this, right? And so why is it important to have the shoulder blades down and back like that? Well, it supports proper biomechanics with shoulder movements and all planes of motion, really, right? And so these are weak in many people that have forward rounded shoulders. Pecs, of course, are tight with forward rounded shoulders. You're getting pulled like this. But anything that brings the shoulder blades back, kind of down, those are weak as well. All right? So often people have forward rounded shoulders, they have trouble with overhead movements, and often they have impingement. Impingement's really pretty much in simple just referring to either tendonitis or bursitis in the shoulder joint, right? So inflamed tendons of the rotator cuff muscles that travel through there under a part of the scapula called the acromion process between there and the clavicle, right, our collarbone, and attached to our arm bones. So they get kind of squeezed in there if your shoulder is not in the right place and the wrong muscles are tight and the wrong muscles are weak, right? And that bursa could get crushed as well. So, boom. Of course, we would like to stand like that. What can we do for them is what's important. Simple one. You go and you go to your wall, put your arms against the wall, and keep them like this, and slide up and down. And try to keep your arms back against the wall and bring them nice and down like this, and then all the way up. And try not to let them come forward like this. Try to keep the elbows and the hands or wrists against the wall, and boom, right? So see if you can do that. That's one we call the wall slides or wall angels, you could also call them. Pretty much anything that's going to bring the shoulder blades down and upwardly rotate them. A good one I like is a face pull. Face pull is great for a lot of those upper back muscles. Lower trapezii are one of them. But that's if you emphasize when you come back, right? First off, pretty much 90-90, but coming down and back a little. But look, I'm not going to go like this. I'm going to bring it here, and I'm going to get these nice and even, like this, not like this. I'm in external rotation, bring them down and back. And I like going all the way up, all the way down. I love that. So definitely a face pull is on my list for strengthening those lower trapezii and, mid trapezii, other portions of the back there. And the last ones are ones you do on the mat. And you're going to be face down. And what you do here is you can just rest your head on the ground. I don't want to because maybe someone was sweaty. He was just laying on this before. I will clean it very soon. Don't worry about that. And I will also slide back, you guys, so you can see what's going on here. You have your arms like this, and you lift them up. Okay, shrink your shoulder blades down, back, up. You can also do these where you come up like this. You can also do these, like this. Anything like that where you're getting your arms to move kind of backwards and down while you're keeping them up like this. So, lower trapezii, definitely number 2. So we got the glute med. We got the nice firm butt there. We got, don't skip my monster walks. We got the lower trapezii, and we have deep core stabilizers. Definitely my number 3. This is more of a group of muscles, but these muscles are many different muscles, including things like Transversus abdominis or Multifidus or pelvic floor muscles that we all do Kegels for, right? Many other things we can do them for. Guys, you should do them too. So we have these types of muscles that are deep core stabilizers, and they do just that. They stabilize the spine. Multifidus travels all the way up and down the spine, the whole thing. And they stabilize the pelvis, right? Like pelvic floor muscles, for example. Transversus abdominis, of course, super important, keeping that core nice and tight and strong. And when these muscles are weak, you commonly see people with an anterior pelvic tilt, right? So they're kind of, standing like this. They're kind of letting they're sitting like they can't posteriorly tilt the pelvis. They're just stuck out like this, doing everything like this, blah, 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 blah. So you'd like a nice neutral posture like that. It's hard to see, the shirt's a little baggy, but you get the point, right? So you're standing up nice and tall, shoulder blades are up and back, and yada, yada. So you see that. These people also have a tough time balancing on one leg often, right? So that's hard for them. And they have low back pain. Very commonly you see low back pain in people that have weak deep core stabilizers. So they're important for a lot of things, athletic movement, stabilization. So how do we fix them, right, is the important thing here. Well, we got bird dogs. You all know bird dog, right? If you don't know, so I'll show you bird dog. So bird dog, you like this, one leg, one arm. Go straight, right? Then the other one. I'm going to hit the table here. So we're just, kind of showing you with my legs hitting it. But, you don't want to kind of come up like crazy or twist. You want to have a pretty neutral back here when you're doing these, all right? We have dead bugs. So dead bugs are when you're like this. And you're gonna take 1, 1, okay? 2, 2. Now if you can do it like this, that's good. If you can do it like this, that's even better. If you can do it like this, that's even better. Kind of transition, actually the V-up's really the hardest. If you can transition into a suitcase crunch or a V-up, those are great as well. All right, so we got bird dogs, we got bed bugs, and the last one is one you may not know, unless you've done some physical therapy for your core or something else in the body, a lot of different things. And this is the pow-off press. So what does the pow-off press look like? There's a cable coming out from the camera right here, about chest height, okay? So I got this handle here. I just pulled the cable off, I stepped away, and I'm holding it like this with 2 hands. Holding it like this, you push out, and you come back in, keeping your core nice and tight, not letting it pull you this way, okay? So you're gonna have to pull it like this, nice and strong. You don't need a ton of weight for this. Straight out, straight back, and keep yourself nice and straight. Don't let yourself be pulled to the side. Weight never controls you, you control it. That's what we got for you guys today. So if you're late to the party, it was 3 muscles that are commonly weak in people. We talked about strengthening the glute med. We talked about strengthening the lower trapezius and deep core stabilizers. Who do we got on here? Let's say what's up to the people. We're going to rock and roll, treat some more patients. Danielle, how are you? D. Silves, Lutter, Westward, Feathers, Stephen Apple Blue, how are you? Pick, Kodiak, Ezekiel Sims, Dave, that's the beast from the east, what's up? How you doing, killer? Good to see you, man. Tommy Reed, Cavono, Ivan, what's up? Love you, man, good to see you out here. Sivia, I'm gonna see your ass tomorrow. Sapar, PD Rumlon, AJ, what's up, dude? Thanks for coming on. And Meg, how are you? The Super UOG, as for now. So we got for you, folks. We'll see you Wednesday, baby. Not sure where, not sure when, but we'll see you then. Have an amazing rest of your week. Thank you so much. I love doing these. And happy Wend Wellness. See ya.